A devastating cancer diagnosis for a St. Louis nurse who sacrificed herself for others.
He said, "You've let this go too long." He says, "This needs to come out, and it needs to come out a year ago."
Yvonne Aviles traveled the country caring for sick COVID patients during this pandemic. Now she's facing her own health crisis. News 4's Caroline Hecker explains why her much-needed surgery is in jeopardy.
Yvonne Aviles' time as a traveling nurse has never been as traumatizing as this last year. After working 13-hour days, 6 days a week for months on end, she says she couldn't take it anymore and needed a mental health break.
You were the only one that could pray with them, that could hold their hand, that, was hoping that there was, it really did a lot to my psyche.
After a 3-month recharge, she got back out there and slowly began to notice she was often tired and had little energy. She chalked it up to long and stressful hours until this past February when she went to see a doctor.
This just came out of left field for us. It was eye-opening and devastating.
She was diagnosed with endometrial cancer in need of a total hysterectomy. The only problem is she has no health insurance. Traveling nurses are considered temporary employees who aren't offered benefits packages. Yvonne says despite being around COVID-19 patients day in and day out for the last year, she wasn't thinking about herself.
How could I complain about feeling a little tired, is how I put it, if these people were dying?
Her daughter says she was angry with her mom at first, but now devotes every day to lifting her up.
It's easier to blame somebody for not taking care of themselves than it is to give praise for giving more of themselves, in the end of the day.
Yvonne's surgery is scheduled for next Tuesday, but if she can't come up with the money up front, she'll have to delay it. A delay she isn't sure she can afford. In St. Louis, Caroline Hecker, News 4.